Hi everybody, it's Dr. Trevor Cottrell here with you again. I'm the Director of Human Performance at Memorial Hermann's Ironman Sports Medicine Institute, and I'm an educational consultant here at Athlete Training and Health. Today is another favorite exercise of mine, the deadlift. Sometimes when we talk about deadlifts, we also talk about the concept called the hip hinge. The hip hinge is a simple motion whereby you are hinging at the hip, thus the name, and doing so with a nice flat back. You notice it's just like a door hinge. This the leg stays stable, the back stays stable, and you're only bending right there at the hip. It's a critical movement to learn because every day you're picking objects off. You've all heard, lift with your legs, not with your back. Why is that? Well, if you lift with your back, you put a lot of load on that ligament system on their back, and that's when you can actually tear some of those ligaments. You can actually cause compression on the annulus or the disc of the spine. You can put pressure on the nerves. Facet joints can come impacted. There's all kinds of little problems that come out of it. As soon as you round this back under load, you're putting yourself under greater risk. So I think it's critical that everybody learn how to do a deadlift and or a hip hinge position. Whether they're an athlete or an average person, you must learn how to lift with your legs, not with your back. Here at ATH, we spend a lot of time working on good hip hinge technique because it's quintessentially a very important position to be in when you're playing all kinds of sports. Linemen and football are in this position. Whenever you're doing heads-up tackling, you're in this position. Coming out of the blocks, you'll have a nice tight back position. If you can maintain this tight torso during lifting, you can move a lot more weight a lot more safely. So the deadlift exercise has become vilified again. People are afraid of it because, oh, you're going to hurt your back if you deadlift. Well, yeah, you will hurt your back, again, if you do it wrong. And too often when people are teaching deadlift, they'll put 45-pound plates on the bar and they'll say, okay, lift it up. And they won't teach the person how to lift it properly. So if you take the time and teach this hinge position, teach that nice tight back position, and progress the weight slowly, you're fine. Your back is going to be quite safe, and you're going to develop good full body strength. The deadlift works all the legs, it works a lot of the core, all the back, right up to the back of the neck, and even a little bit of the arms hanging onto the bar. Here I have a demonstrator who's going to show you nice strict deadlift technique. So the deadlift motion is going from the floor to a standing position in one movement. You're starting with the bar over the shoelaces, back's nice and flat, hips above knees but below shoulders, back tight, sit back, chest up. And then you're going to extend with the knees first and then extend with the hips. Standing up nice and tall and then reversing course down. You bend at the hip, then at the knee. Do it again. Straighten the knees, straighten the hips, bend at the hip, and now bend at the knee. The bar will slide up the thighs once it clears the knee. That's pretty normal. You want to keep the bar close to your body. And you can see in this position, they're quite safe. Oftentimes, though, you'll get some wonky positions. The most common issue they have is they just can't set that chest up position. That back can't be round, it can't be flat. So round it out. Yeah, butt down a bit though. There, that's what you'll get. A lot of people, they can't get in that nice flat back position, so now they're loading that ligamentous system of the spine, and you want to avoid that. So it's tricky to get people to learn how to do that from that deadlift position. So what we do is we work on the hip hinge in isolation before we teach the deadlift. So if you aren't sure if you can deadlift well, do this little experiment with yourself, or if you're a parent, watch your child do this. What I want you to do is stand with your feet at hip width, toes pointing straight ahead. You're then going to put the hands behind the head, pull those elbows back, chest up, head up. Now just slightly bend the knees, just slightly, and then fix the knees right there. Now keeping the weight on your heels, you're going to push that bum back and bend, hinge forward at the hip, and pause. So what you're looking for is getting past 45-degree angle without bending the knees much more than the soft knee. Can you straighten your knees just a touch? There, that's where I like it. You'll know you're in the right position because you'll feel the hamstring stretch. If you do not feel the hamstring stretch, that means that you're probably rounding the back. So show me what happens if you round the back. That takes the hamstring stretch away. Now straighten again. What you want to do is keep those hips pushed back and that back nice and tight. Come back up. So we call that the good morning test or a hinge test. Do it again a couple times. So if you're not doing that, then we have to teach you how to do that. And here at ATH and at Memorial Hermann, for that fact, we are experts in teaching technique, and we can get you into that nice flat back position. Some people call this a Romanian deadlift, so we'll have our trusty model here demonstrate for us a Romanian deadlift. And that alone is a fantastic exercise. Now you're taking the hip hinge movement and you're loading it. So just stand up with a normal, okay, chest back. Head grip, now grip is just the thumb's length away from the thighs. Everything nice and tight. Weight on the heels, wrist turned under. Keep the bar close to the body, push the hips back. Feel the stretch, and then squeeze through the butt and hamstrings, pulling back up into the top position. That's the Romanian deadlift, or often called the RDL. Back in the old days, they call them stiff-legged deadlifts, but they were done differently. You can see from the front, nice linear position of the body, no shifting of weight, head up, chest up. But the side view is the most important one. So that, my friends, is the hip hinge and deadlift motion. Really excellent lifts for lower body strength, excellent lifts for developing hamstring strength, preventing hamstring strains, and improving your ability to lift safely if you're just the average person. Teaches you good postural awareness. It makes you stand tall and learn how to walk with your chest up. So that is our tip of the day on the deadlift series here at Athlete Training and Health. Come on by, we'll put you through a workout.